Hello, everyone. Welcome to the Lancet Global Health Launch. My name is Jennifer Roberts, and I am an associate professor in the Department of Kinesiology, the School of Public Health, University of Maryland. Before I jump into the particulars of the research, I want to talk about the collaboration. And in 2018, at the 7th International Society Physical Activity and Health Conference that was held in London, the World Health Organization launched its global physical activity strategy for more active people for a healthier world, and since the collaboration was established. This collaboration is international, multi-organizational, multi-panels, and it has a variety of disciplines, including public health, urban and spatial transport planning, geospatial science, and behavioral and public policy. Again, there's over 80 collaborators from 25 different cities, 19 countries, and 6 continents. And so subsequently to the collaboration being established, there was also the Global Observatory of Healthy and Sustainable Cities. And that was established to basically create this Lancet Global Health series that I will be presenting today. So what is the Global Health series? It's basically commissioned by editors of the Lancet or even academic partners and institutions. And basically, it's a series that brings together international researchers, international authors. And it's really, the point is to take an in-depth look at a topic of special interest or to explore new thinking that advances science, medicine, and public health. The first series was launched in 2003, and there was a particular one that was launched a few years ago that was also urban design and transport and health series. And so we've launched ours in 2020, and the series is supposed to be a multi-paper series, and we also wanted to have open commentary from the World Health Organization. So the goal of our series was really to identify and benchmark indicators of pathways to creating healthy and sustainable cities. Again, this is a multi-paper series where we have 4 papers that build upon each other. We also have this introductory commentary from the World Health Organization. Leaders from WHO agreed to present this commentary and write this commentary to discuss the importance of urban dimensions for health. And in light of the pandemic, they also wanted to make reference to WHO manifesto, which was an attempt to achieve a healthy recovery from COVID-19 and to highlight the intimate and delicate relationship between people, places, and the planet. So the study I'm actually going to be talking about today is study number 4, using open data and open source software to develop spatial indicators of urban design and transport features for achieving healthy and sustainable cities. So in essence, this is a 25-city study. So looking at some of the background of this particular study, this was to develop methods for calculating, validating, and visualizing spatial indicators of urban design and transport features that support healthy and sustainable cities. This includes aspects of public transport, walkability, and overall neighborhood amenities. In terms of the methodology, I'm going to try to walk through this in a couple steps. First, again, the 80 collaborators, they were each, or not actually each, but some were allowed to offer up or nominate cities of choice. And cities were offered in the sense that if you had data that was GIS data, or if you even had the expertise to analyze the GIS data for representing this particular region. Second, once the cities were actually selected, we had to define the city boundaries, specifically the urban portion of those boundaries. And those were defined based on the geographical borders that were under jurisdiction by the governments. So for Baltimore specifically, we decided to use the Global Human Settlements database for the urban boundaries. Afterwards, we had to actually collect the data. And this is basically open mobility data. We use OpenStreetMap, we use the global health indicators, global health settlements data, as I had mentioned before. And this data was pre-processed with a series of Python scripts. And once this processing occurred, we were able to take these sample indicators and basically map and visualize them for each city. Again, there's 25 cities within the study. 3 of the cities are in the United States. So including Baltimore, we have Phoenix and Seattle. So the spatial indicators that we have kind of group into multiple categories. We have food amenities, so access to fresh food markets, such as a supermarket. We have transport amenities. We have recreation amenities, such as access to public open space. And then we also look at walkability, and we also look at physical activity, which I'll discuss in more detail in one moment. So how did Baltimore perform? Well, in terms of amenities, the percentage of Baltimore population within 500 meters, which is roughly about a third of a mile, to amenities, they weren't doing as great. It wasn't the worst of the situation, but there's definitely room for improvement, particularly as we look at access to fresh food markets. So as you can see, for example, only about 14% of the population has access to fresh food markets or supermarkets that are within a third of a mile. In terms of walkability, we see that overwhelming research, first of all, has shown that walkability is good for your health. It increases your access or your opportunities for physical activity. But that can only occur when there's certain parameters that are in place for a neighborhood to be walkable, such as population density, such as mixed use amenities and places to go to. So you want to have destinations to walk to, as well as well-connected streets. And what we found was that 55% of Baltimore residents live in neighborhoods that were with walkability scores that were greater than the 25 city median. And so if we look at that, we can see that on this map, the highest walkability are within the inner part of the city or near the inner harbor. And if you're curious in comparison to the other cities were kind of on par. We did a little bit better, but it's not that dissimilar. So for example, it was about 51.5% in Phoenix and about 44.6% in Seattle. Regarding public transport access, again, this is another aspect that is considered a social determinant of health. When you have public transport access, it encourages active transportation, which encourages physical activity. It improves access to employment and other opportunities. It can also increase social inclusiveness. And it reduces air pollution because you have less cars on the road, so less tailpipe emissions. In Baltimore, we found that roughly 43% of Baltimore residents have access to public transport with 20 minutes or better weekday frequency. And looking at this map, you can see that the transportation accessibility kind of radiates throughout the whole city, starting from the inner harbor area and radiates outward. And in reference to the other cities, we are doing, much better, for example, than Phoenix, which only had about 24%, and in Seattle, which has about 26.6%. Looking at public open space, in addition to public transport, public open space can also encourage and promote physical activity. It improves physical health, it improves mental health, and it actually cools urban areas. It's also been known to protect biodiversity. So in looking at findings related to Baltimore, about 39% of Baltimore residents have access to public open space of 1.5 hectares or larger. And we can see this kind of marbling effect throughout the city where we see these larger open public spaces. Comparing to the other cities, we're doing a little bit better, than Seattle and much better than Phoenix, which is at about 25%. So moving on to physical activity. So we did a spatial analysis using population and intersection density indicators for 2 physical activity scenarios. The first scenario was whether or not it was an 80% probability to engage in active transportation by way of walking. And then the second scenario was for reaching WHO's target of a 15% or more relative reduction in insufficient physical activity, also through walking. And so when you look at these 2 different indicators, neighborhood density as well as intersection density, you can see that when these 2 are achieved, you're going to have an optimal opportunity for walkability. And when I'm talking about population density, or when I'm talking about intersection density, I really mean the number of persons or the number of intersections per square kilometers. So specifically in regard to what we found, we saw that in general, for all of the American cities, less than 50% of the population had population density as well, or for scenarios A and B. And then the number of people who actually were exposed to the intersection density threshold that was needed for physical activity, it was a little bit higher in Baltimore and Phoenix for both scenarios A and B. So looking at kind of summarizing all of this, we found that for fresh food access, only about 14% of Baltimore neighborhoods have access to a fresh food market or supermarket. We also see that about 29% of Baltimore neighborhoods have access to a convenience store or a corner store. For walkability, again, apart from that inner city area near the urban harbor that we showed on the map, the majority of Baltimore neighborhoods have low walkability relative to the other 24 cities. And also for public transport, a minority of Baltimore neighborhoods have access to public transport stops with regular service within 20 minutes. Regarding the physical activity target, specifically the target that WHO set in terms of the 15% reduction of physical inactivity, we see that only 28% of neighborhoods meet the population density to achieve this target, and a little more than half of the neighborhoods meet the intersection density to achieve this target. For public open space, about 40% of the neighborhoods have access to a very large public open space. So given all of this data and the sustainability report that was summarized for Baltimore City, I was able to actually share this with Mayor Brandon Scott. And he actually has some remarks in reference to what was found, and I wanted to share this with you today.
Peace, everyone. This is Mayor Brandon Scott. One of the core pillars of my administration is creating clean and healthy communities, which includes analyzing and improving our efforts to enhance the well-being of our residents. I am thankful that Baltimore was selected to be in a cohort of 25 cities around the country for this international study to analyze where our city ranks in terms of urban design, transport, and health. The study revealed areas of opportunity for us to make our city more viable for our residents, many of which I'm well aware of and my administration is already addressing. These findings give us the data we need to support our efforts in creating a brighter, better, and more sustainable Baltimore for all of our residents.
So I'm thankful for being able to share these findings with you today, and I look forward to discussing solutions of how we can achieve a better charm city.
At the University of Maryland campus. He is the director of the Stormwater Infrastructure Resilience and Justice Lab, and they investigate flood risks and how communities can adapt and address barriers within the human-built environment context to effectively mitigate disastrous consequences from stormwater runoff. Next up, we have Dr. Shadi Muki. Perfect. I was practicing. She is the Community Health Director at the Trust for Public Land and is also the Commissioner of the Maryland Community Health Resources Commission at the Maryland Department of Health. At the Trust for Public Land, she advances built environment and nature as underutilized tools for community health. And as a former CDC Public Health Prevention Service Fellow, she also works on strengthening public health systems globally and on the relationship between urban design and health impacts domestically. And she also led a task force on preventing substance abuse during pregnancy in the Baltimore City Health Department. So she is very well acquainted with Baltimore City. And then we have Dr. Noel Brathwaite, who I'm proud to say is also a Caribbean native, just like me. He joined the Office of the Minority and Health Priorities at the Maryland Department of Health in 2017 as the director of that office. He is an international public health expert who gained experience working with health issues in the US, the Caribbean, and parts of West and East Africa. During his time at the Office of Minority Health and Health Disparities, he was instrumental in establishing the Health Equity Resource Advisory Committee. And he recently left the public service and started his own health consulting practice. And then we have Dr. Seema Iyer. She's the Associate Director at the Jacob France Institute at the Merritt School of Business in the University of Baltimore. She oversees the Baltimore Neighborhood Indicators Alliance, which is also part of the Urban Institute's National Neighborhood Indicators Partnership that provide longitudinal community-based data on demographic, housing, crime, education, and sustainability. And last but not least, actually we have two more people to go. What am I saying? Okay, so Dr. Ramy Sakhbuta, he is the professor in the Maryland Institute for Applied Environmental Health Care at the University of Maryland. And his research group focuses on the intersection of climate change and human health, with particular emphasis on cardiopulmonary, renal, and diarrheal diseases. His group's ongoing collaboration with the Maryland Department of Health has demonstrated the ongoing health impact of climate change in our communities. And then finally, we have, and I should have had these in order, my goodness. One more page to go. And we have our delegate, Robin Lewis. She is the state delegate in Maryland's 46th district and has been a member of the House of Delegates since January of 2017. Delegate Lewis is a leader in healthcare, transit, safe, and livable communities. And she's the first African-American woman to represent District 46, which is made up of all the communities around Baltimore Harbor and Baltimore City. During her time in public service, she has sat on many important committees that influence public health, including the Public Health and Minority Health Disparities Committee, the Environment and Transport Committee, and the Land Use and Ethics Committee. So I welcome all of you here today. Thank you so much for joining us, and I will turn it over to Dr. Ramy Sakhbuta, who will get us started with our Q&A session. But actually first, what we will do, we will allow each of our distinguished panelists to give us one aspect of how the study findings impact their work or mission. So each panelist has 4 minutes to give us their ideas, and I'm so sorry we only have 4 minutes for each person, but Dr. Hendricks, if you could take it away.
Sure. Thank you, Rihanna, for that wonderful introduction, and thank you to Dr. Roberts for organizing us all and for having us here this afternoon. And also let me pause and say, you know, a goal of mine is to have a poise of Dr. Roberts in the midst of still deliver an incredibly important talk with some things that are notable that I think we'll all discuss and touch on this afternoon. And so I think, you know, in reflecting on the work that, you know, this Lancet report has demonstrated, it really takes me back to my origins into academia and my training in public health, and sort of the discovery during my time working on my master's in public health of thinking to myself that oftentimes in public health, we intervene at a point in these dynamics where a lot of decisions have already been made, right? And we intervene sort of in the aftermath of designing and development of communities that ultimately set the stage for a lot of public health consequences and impact that we see from a public health perspective. And so during my time in public health, it really challenged me to think about how do I get after the root cause of some of these issues that I have been studying in public health. And so I sort of shifted gears and found my way over in the College of Architecture in the Landscape Architecture and Urban Planning Department, where I studied sort of environmental issues through design and development and thinking about what are the root cause of a lot of these issues in public health. And also, this is an opportunity for me to sort of shamelessly plug and promote a forthcoming piece of mine in the American Journal of Public Health, a piece titled Leveraging Critical Infrastructure Within an Environmental Justice Framework for Public Health Prevention. And in this piece, I sort of opened up with this scenario of thinking about if we think of communities as a stage play production, land use will represent the markers on the stage, and infrastructure will represent the props, systems, and facilities in which the actors live, work, and play, the quality and production of the performance, opportunities for how the actors move, interact, communicate, and access to basic technology and technical support are all predicated on the inventory, condition, and distribution of these critical props and systems. And so I say all of that to say that, you know, infrastructure development mediated through an environmental justice framework metaphorically and quite literally sets the stage for essentially all outcomes related to the built environment, from scenario planning to public health. And also in this piece, I say that, and really sort of leaning on Dr. Roberts' work and some of the findings from the report, well, I wrote this before the report came out, but it's connected in terms of ultimately there's an opportunity to sort of leverage infrastructure within an environmental justice framework as a form of pre-primary public health prevention. For example, the primary prevention prescription for chronic illness such as cardiovascular disease and diabetes is exercise. But exercise at the neighborhood level is severely limited without access to parks, sidewalks, and recreational facilities. The basic infrastructure, again, that sets the stage for these public health outcomes. And so there's evidence that suggests that disparities also exist in the distribution of infrastructure along the lines of race, ethnicity, and class. And so infrastructure and environmental justice are critical prerequisites in public health if we want to ultimately move toward a more just, well, and resilient community. And that's why for scholars have long documented that above and beyond any physiological indicator of health, zip code is one of the best predictors of public health at the neighborhood level. And all of that begins, again, with that stage in terms of critical systems and resources, facilities, utilities that ultimately provide an opportunity for folks to achieve those health promotion, health-related gains that are inextricably linked to the built environment. And so I'll stop there and pass it to my colleagues. Again, I think hopefully I'll set the stage for a lot of the comments to come from my colleagues. Thank you.
Thank you
so much. Cheers together for what boys and what brings under a bit of pressure with technical difficulties. Hi everyone, my name is Sadia McKee. I am the Director of Community Health at the Trust for Public Land. Now, I'm going to guess the majority of you do not know who or what the Trust for Public Land is. We create parks and protect land for people. That for people part of it's really, really important, right? When we think about design, when we think about infrastructure, you can think about the specific physical feature, and completely ignore what our end goal is. And our end goal as the Trust for Public Land is health, it's climate, it's equity, and to do so, we place community at the center of all of the work we do. That means whether we're working on a schoolyard or working on large landscapes like the Zion Narrows, we have community engagement in the process. And communities, local communities, that means third graders are saying, actually, we need a pink basketball court too, not just a blue one. Why is that, girls? Well, is that, do you love the color pink? No. We know that the boys will leave that alone, so we'll have time to play at the basketball court as well. That's end user information that we need to incorporate as we look at integration when it comes to the built environment, when it comes to access to nature. Now, our goal is to connect everyone to the outdoors. The outdoors, I would love to ask you all, what better prescription do you have when it comes to cardiovascular disease, when it comes to sleep, when it comes to mental health, when it comes to social connection, do you have than being in the nature, being in the outdoors? It's very, very hard to come by. So in order to do so, how do we go about doing this? We incorporated GIS work. So I would encourage you all to take a look at, there are a number of additional indicators to look at when it comes to park access. Not just whether the open space exists, but do you have a 10-minute walk access? Can you get there within a 10-minute walk? We just released our national rankings. Washington, D.C. is not that far away from Baltimore. It is #1 city. Baltimore ranks number 30. What are the mechanisms then, we ask, that are driving them? What are the policy questions that we need to ask? And what are the infrastructure and investment questions that we need to ask? So let's look at our history. When we look at our policies, which communities are invested in, which aren't? The specifics around how we invest by placing end users at the center of the process is going to be critical. And those end users cannot just be one group of individuals. It has to be an integrated group. It has to be a community advisory board made up of the health department, which is already under significant pressure. pressure. It has to incorporate in your private sector folks in health, right? So when I'm looking at my former role in community health at CareFirst Blue Cross Blue Shield, that was a very different approach that we took as a grant maker. Very different approach when we're at the city health department, bringing that coalition together. So who needs to be at the table? How do we bring those folks together at the table? And then pushing forward on investment in an equitable way, in a prioritized way. So as we move forward, I'm so excited about the work, but when it comes to partnerships, we need to make sure policy, practice, and community are at the table moving forward. Thank you.
Thanks for the opportunity of being here and participate in this process. I live in Baltimore. I live in Baltimore City. When you think of Baltimore City, there are two Baltimore cities, not just one. And I represent, in a great extent, the vulnerable population in Baltimore that very often is overlooked when we look at what is happening in Baltimore City. So my perspective, one thing I've gotten from this study is the protection of vulnerable. And how can we protect vulnerable people who have been disenfranchised and who lack a number of livable amenities that might not be uncovered by a study. For the past 4.5 years, my experience in Baltimore, walking the streets of Baltimore, riding the streets of Baltimore, taking the train in Baltimore, visiting and walking in the parks of Baltimore, such as Patterson Park, Druid Hills Park. And not only that, but the study that was done, even the Purple Line study, even though that was not Baltimore. The Purple Line study gave us an indication that along the train lines, there are going to be vulnerable populations that are going to be disenfranchised by the system. And when I look at Baltimore, when I take the train from the west side of Baltimore to the east side of Baltimore, I find that the ridership from the heart of Preston Street to Hopkins differs. And then when I look at a study like this and ask the question, are we dealing with West Baltimore or are we dealing with East Baltimore? I happen to live on East Baltimore, where there are multiple sidewalks. And when I walk into Baltimore, then there is a transition from the walkable side of Baltimore to the avoiding of the traffic and some parts, not all, but some parts of West Baltimore. And when I look at the access to food and the access to liquor and alcohol, there's a disparity. So my function has been to look at the disparities. And a study like this that tells us that the train system and the transportation system, we should ask the question, is there a level of disparity between the two neighborhoods that I consider to be Baltimore, the East Baltimore and the West Baltimore? And so the instruction of this particular study tells me that disparities between the two Baltimores might not be highlighted by the study because we have a study of Baltimore instead of not looking at specific zip codes. We don't have a sense of the zip codes that were studied in this study. And as for Baltimore as a whole, in terms of the lesson, the one thing is that there's a level of disparity in Baltimore, structural disparity. Disparity of the train, where the trains could be disparity of walkability, disparity of access to food. And so the whole notion of disparity is something that we have to deal with. Hopefully, a follow-up to the study will examine some of what can be done about the disparities in access to train, disparity in access to food, the disparity in access to park location. To get from Patterson Park to Druid Hill Park, you can't take the train. And you might ride some parts of it, but most of all, between Patterson Park and Druid Hill Park, more likely you have to take your own transportation. And there's a shortage, less than 30% of minorities within Baltimore own their own cars. So that's another part of disparities that we have. Thanks to you, Doc, for the study. And I think the takeaway lesson from it is that disparities, even in transportation and in food and access to walkability, is something that we certainly have to address. The key, I think, is that lack of resources. The great problem setup that is, in order for us to somehow get rid of some of the disparities, more allocation of resources will have to be dispersed. Once again, thanks for the study, and it highlights again that we need to address the disparities.
My name is Seema Iyer, and I'm also very grateful to be here, and congratulations to you. You have wrangled so much data. I have a clear understanding of how much data analysis you did to create a very simple and very clear for anybody, not an academic kind of report for anybody. And I'm very happy that the mayor of Baltimore saw it, and I personally like the mayor of Baltimore, but I wish he wasn't smiling. This is an indictment on what a terrible situation Baltimore is in. 100%. You have told us very clearly that we, in an international setting, are below average. We have no policies or very few policies. When we do have policies, we have no goals, and we don't have any plans. We need to take a stand using these kinds of very simple measures, because nothing is going to change if we don't act with urgency. And so for all of you that are students in the room, don't just look at the data and think you can't do anything about it. You must do something about it. You just heard a couple of things that you might be able to do about it. But look at the disparity that is very clear in the maps. Look at the numbers. I would love to know, I have a lot of technical questions. For example, were all the North American cities below average, or was it just Baltimore? How did we rank with Phoenix and Seattle in terms of resources? Seattle is a much, much, much wealthier city than Baltimore. Baltimore is continuing to lose population overall. We are a contracting city, largely because of exactly these factors. If it's poor quality of life, you're not going to attract more people to come in. And so, I would love to think technically about this, but I feel like you have presented very clearly an action of urgency. And I don't know what more evidence we need than something like this. So I appreciate that. I'm going to turn it over eventually to our delegate, Lewis, who's my best friend, really. But I want us to have our elected officials really look at this data and act with urgency.
All right, good afternoon, everyone, and it's a great pleasure to be here. And I, like the prior panelists, want to commend Dr. Roberts for putting this report out along with our colleagues. My name is Ramy Sakhbuta. I study primarily climate change in human health. In that capacity, back in 2016, we put out the state's first climate and health profile report. And during that work, what we noticed in every single way you look at it, Baltimore fares worse than other counties in the state, whether that be asthma hospitalization or whether you're looking at extreme heat-related heart attack death. Baltimore is by far the worst, right? And when you see data like that, it's sometimes tempting to say, yes, that's a black and white difference, it's minority majority difference. Well, is it really? And our data says otherwise, right? There's more to it than just the black and white differences, the minority majority differences. Because if that was the case, then we would see similar thing in Prince George's County as well. In fact, we don't. Prince George's County fares better than the state level average consistently. So what is different between Baltimore and Prince George's County? Right, if you look at Baltimore City, predominantly the minority populations are African Americans, but in Prince George's County, we have mixture of, blacks, but also Hispanics, Asians. But if you look at within that, African American community in Baltimore City, they are living in abject poverty, whereas in Prince George's County, we have one of the wealthiest African American communities in the country. And with that comes social determinants of health, access to salutogenic infrastructure, whether that be park, walkable neighborhood, access to healthcare, insurance, doctor's offices, and so on and so forth. Right. So these are the underlying, sort of like salutogenic infrastructure that makes those, that explains some of that differences. And I appreciate the indicators that Dr. Roberts and our colleagues have created because it helps to highlight some of that disparities that are tied to poor health outcome, right? But it's one thing to create those indicators, right? But my question is, what are you going to do with it, right? That's where the action is. Yes, we have indicators, tons of indicators, EPA, environmental justice screening tools, so on and so forth. But I implore Dr. Roberts and our colleagues to take it to the next level, is how do we use these indicators for the betterment of health and well-being of the communities, residents on these underserved areas, right? And I see opportunities. I see lots of opportunities. I don't know how many of you have been paying attention to the 5 million tree initiative that the state legislators passed last year. Maryland is committed to planting 5 million trees within the next 10 years by 2031. There's a lot of resources tied to that. So my question is, can we use these sort of indicators to identify that neighborhood that lack green spaces, right? That lack park, right? And then build that infrastructure on those communities that desperately need those. It's one thing to, so that under that law, like 500,000 trees are supposed to be planted on the urban areas. So can we use to leverage a lot of that in Baltimore City, right? But it's one thing to plant tree in the suburbs, right? Hey, tree grows in my backyard if I just don't mow, right? I don't even need to do anything. But think about growing a tree in Baltimore City in the concrete jungle. It's very hard. So that requires a lot of effort, caring for 1 year, 2 year, 3 years after you plant. So my question is, can we use some of that resources under that 5 million tree initiative to create jobs for the urban youth that do not have access to like a fair job in their communities and leads them to engage in other sort of activities. So can we use this as an opportunity to build green jobs, create green jobs for high school youth, so that they can be trained and some of these activities. So that's what I see a lot of opportunity, and like I said, I implore Dr. Roberts to look into it, and I will be paying attention to how it unfolds. Thank you.
So thank you for being here today. My name is Delegate Robin Lewis. It's really a delight to join all of these public health experts. I just want to say that, because I'm around a lot of legislators, it is so relaxing and pleasant to be around public health. You guys just enjoy, all of you. And I'll tell you why. I was sitting here thinking about, like, why am I so happy right now? It's not just because, I'm honored to be here, and thank you, Dr. Roberts and the team for this invitation. It's an honor to be here at the University of Maryland School of Public Health. But I'm also thrilled to be here because I'm surrounded by people who think in terms of systems. And I don't have to explain that to any of you. You understand that the world is not linear, and that our decisions don't necessarily have linear impacts.
and things are a lot more complex and interwoven and mutually influencing, and like, we love that stuff. We love measuring it and talking about it and judging it, and so it's just a pleasure to be here. That said, I get to go last after a panel of brilliant people who just told all of you that Baltimore is in big trouble if we don't do something. I want to reflect something I think I heard Dr. Roberts, or maybe it was your dean, say, that public health experts, like all of you in this room, are optimists. And that despite everything we know about complexity and all the difficulties that we face, the lack of resources, we can attend to those realities and still believe that something better is possible. So that's why I'm really happy to be here. I want to answer the question that you posed, Dr. Roberts, and it was, how do the findings of this study impact my work, my mission? And that's a really good question, and I take it as a challenge. And my answer is this: the findings of the study reinforce for me that I'm not crazy. And I think, as my good friend, Dr. Seema Iyer said, this findings reinforce the reality of Baltimore's difficulties, and also shine a light to some solutions, an array of solutions. And as public health people, we know there's 20 million different solutions, and we have to pursue all of them. So I feel encouraged by the findings. I'll tell you why I think I'm also a really good person to close out the panel's introduction. It's because I try to do a little bit of what each of you has already done, and that's to apply the very best practices and principles to transforming our world in the service of human health. I'd like to answer Dr. Sakhbuta's question. How do you plant trees at scale in an urban environment? Well, sir, I have done that. And in Baltimore, where we have so many difficulties, we also have a lot of models for what works. We actually have the tools, the brilliant people, the energy and imagination. We already have all those things to apply solutions like urban tree planting. So in around 2009, I was a neighborhood leader in my neighborhood around Patterson Park, Dr. Brady, which you spoke of so glowingly. But we have our troubles, but it's a great park. But in the neighborhood around the park, north of the park, we had a 2% urban tree canopy. And for those of you who are nuts about trees, you probably know that a healthy urban canopy is about 30 to 40%. And that is to say, a bird's eye view of the landscape should show that about 30 to 40% of it's covered in green vegetation, ideally trees. Our canopy was 2%. That is like a desert, the desert made of concrete, not a jungle at all. And what I and a couple of my friends decided to do at that time, we were all young and energetic and working very actively to transform our neighborhood so that it could meet, the vision that we all had for it as a place of beauty and joy and fun and welcoming and health. We decided to start planting trees. Because I'm a public health professional, I know how to write grants. I've written grants for NIH, USAID, I worked in international health for 20 years. So I wrote a couple of grants, like the Chesapeake Bay Trust and the Parks and People Foundation, and raised almost 70 grants. And we planted over 300 trees, and we increased the canopy from 2% to 20% in about 2 years. Not only did we do that, we put the trees in the ground. But I think Dr. Sapkota's point was well taken, that you've got to maintain them as well. It's just like any public health intervention. It's not enough just to deliver to the infant the regimen of childhood immunizations. You've got to feed the kid and keep them from dying of, diarrheal dehydration. And, it's only one part of it, but we managed to keep our canopy alive. In fact, over 2 years, we had something like a 95% tree survival rate, which is more than twice the normal, because we built a community, a network of support for every tree. So there's this model called community greening that was highly developed in Baltimore City. I was, trained in that philosophy by some great people, and I applied it in my work. So here's the thing. Here's what we know. There's so many other examples I could give you. As a public health professional in a lawmaking position, I'm a very rare species. I think also, can bring together what my esteemed fellow panelists mentioned, which is that what we do is apply what we know. The policy piece has to be part of the equation. And as a public health person in a role as a lawmaker, let me just tell you, it's a tough battle. I wish there were more of you in the state legislature. I wish there were more MPH holders in the positions of policy power. I encourage, if there are any graduate students in the room, come see me. I've got some internships and fellowships for you so you can eventually take my job over, because I'm only one of 2 MPH holders in the Maryland General Assembly. Unacceptable, people. So we need to work on that. And I'm here to help. We need to be in room where decisions about resources are decided. I'll also mention that I try to live my values, and it's not easy in Baltimore City. I'm the only member of the Maryland General Assembly who does not own a car. I choose not to own a car. I have the freedom and the options to choose not to. But I think, as Dr. Braithwaite mentioned, about 30% of Baltimore City residents don't have access to a privately owned vehicle by no choice of their own. And they are truly dependent on the quality of public transit that we have. So I live without a car. I almost didn't get here today. But anyway, what that means is I'm thinking always about applying public health best practices, adapting to find solutions in ways that other people don't think of. And I will promise I will wind up. I want you guys to know that there are examples of policymakers like me, but we need your help. We need to be in coalition in a very deliberate way, in the same way that coalitions around anti-abortion, anti-vaccination, the way they're organized, we need to be organized about building communities that are health giving. And I'm happy to be a partner with you on that.
Thank you all so much. So I'm Dr. Ramy Sakhbuta. I am an environmental health scientist here in the School of Public Health, and I'm delighted to be joining Jennifer and Rianna here, along with all of our other colleagues who have supported this event. And congratulations again to Jennifer. Just the study itself was such a huge lift, and as we've heard today, it's creating just wonderful findings that are easy to digest, that can really be used to leverage new policies in the future, which is just fantastic. And again, congratulations on pulling us all out of our dining rooms and our living rooms. It's all these bumps along the road to try to get back into person. And we're going to have these technological problems as we try to do these hybrids, but kudos to you to bringing us here together. Just such a fabulous event here. And thank you to all of our panelists for joining us today. So I would like to launch us into a question and answer session. And I thought I would just start with sort of a very broad question, as our audience can also sort of get questions going in their minds. So to our panelists, what I wanted to first ask is, Jennifer and her colleagues' report have revealed a number of different areas for improvement for Baltimore City. So my question to you is, we want action today. We don't want to just have these data sit and maybe think about something to happen in 5 to 10 years. So what could be those, quote unquote, lowest hanging fruits that we could possibly, address today, within this next year, to start tapping away at addressing some of these identified health and sustainability needs? Yeah, go ahead.
I think get us started, it helps. So there has been a sort of underlying current here in terms of the conversation around partnerships and the conversation around policies, right? Or overt conversation around policies. One of the initiatives that we're working on with Trust for Public Land is a partnership with an organization called City Health. City Health is based on this concept, essentially. It's an initiative of the Beaumont Foundation and Kaiser Permanente. And the idea that our policies inform our health. And so they're incentivizing cities across walkability policies, across green space policy, urban tree canopy, and park is the one that I work most closely with them on, but a range, access to alcohol, access to food. So as we engage, and these are just, they're not even operational yet. Do we even have the words in the books, in the law of the land to move that agenda forward? So I think that's sort of in a very sort of structural way. And then we have a sort of idea of exceptionalism in the US that we only learn from each other. There are a number of other cities I noticed across the world that we have an opportunity to learn from. So we're in the most short-term conversation. What is that conversation we need to have with Chennai? What is the conversation that we need to have in Europe, et cetera? So how do we bring people together around that learning?
I think in the short term, Baltimore pre-pandemic is not the same as the Baltimore post-pandemic. I think that one of the things that we should do is, since you have survived the pandemic, what is the next step for you in your resiliency? And that is a conversation that we need to have. The data that we might have had before the pandemic may not instruct actions in 2023. So you may have to have a different level of conversations. I think that's a conversation that we have started before. I about 10 days ago. And the conversation that we are having through the Health Equity Commission is one that is going to inform the current thinking of the residents of Baltimore. And that commission is going to lean on the voices of the people through town hall meetings and so on. So I think we now have to rethink what we want Baltimore to be like coming through a pandemic. And the old paradigm that we had, we might have to have a paradigm shift. And one of the first starts that we as professionals and students can do is to listen to the voices of those now who survived the pandemic and ask, what's next? The solutions that we might have had before would have to be reviewed, but then they would have to be reviewed in the context of what are the people saying now. And take it from there and then go on to form your policies and your programs. So I think if you have healthy dose of listening to those who came through the pandemic.
I have some ideas. So thank you so much for the question, Dr. Ramy Sakhbuta. Oh, wait, are there two Sakhbutas? Okay, you've been outed. So thanks for the question. Here's what in my view, what we can do right now. Pass some daggone laws that will enshrine the things that we know work. So Dr. Braithwaite just referred to the Health Equity Commission. That was created in law by one of my most honored mentors, Senator Shirley Nathan Pulliam, who took me under her wing in my very first years in office. And we worked together, she in the Senate, me in the House, to pass a bill that created a statewide Health Equity Commission. I mean, I don't think there's many other states that have that. The work of the commission is interesting, and the key is to translate its recommendations into action. And that's where you guys all come in. But we need more of that. We need to do things like pass laws to improve bus service, because we know that the quality of the bus is the workhorse of the transit system. And if your bus is working well, then other things will work. More people depend on buses than they do on rail. The buses aren't working, people aren't working. They're also not going to the doctors. They're not getting their regular blood pressure checks. The kids are not getting immunized, etc. So make the buses work. Pass some laws to make the buses work. Well, I just did that. But you guys, it took me 4 years. And it was a bill that only a city, it's a local bill that we pray, we believe will improve bus service, but I know that it's important, not just as a policy principle, but because the people in my district tell me so. So that listening piece is already happening. Help us pass some laws to apply what we already know and scale it. Invest in healthy housing, improve transit, really put some teeth behind parking restrictions in our land use and zoning policy. That's going to be tough work. It's going to be a generation of effort. It's going to take some of the young people in here to carry it on. It is absolutely essential to address climate change. So I think that's really important. It's not just because I'm a legislator, but because I've been an activist. I've been a public health researcher. And I'm here to tell you that the rubber stops where the policies get made. And so that's my spiel.
Here's another point, Delegate. You can pass legislation for some like unfunded legislation.
We don't do that anymore, Dr. Brinkley. We fund this stuff. We have to. And I know what you're saying. It happens all the time. Anything like the Equity Commission, you guys have come up with great recommendations, total sensible recommendations. Don't need any money behind it. But here's how you get money for the things that matter. Elect the right people. I know we're in an academic institution, but when you guys walk out of this place, your experience of the world is dependent on people you voted for locally. And so get some more public health people in office. A lot of practitioners are good. You need a couple epidemiologists, but not too many, because they're nerds. But I'm just kidding. I love it. But that's how you get money. That's it. So,
And it's not just money at the state and local level. We passed a bipartisan law around infrastructure. How many public health people are driving where that investment goes? Who's involved? Not enough, right? How are you determining this? So not just looking at passing more and more policies, what is the framework, what is the landscape analysis that needs to happen in terms of how those opportunities need to be leveraged so that we actually optimize health at the end of the day? And that might be now, but also in the future, right? Like, we're not coming out of climate change in a very strong manner right now. So I think there's a lot of opportunity as a fellow optimist.
And I'll quickly add, sort of with my dual hat on between planning and public health, is that a lot of the things that my colleagues have talked about are centered in urban planning and development. In the School of Architecture, Planning, Historic Preservation, Real Estate Development, we can't address housing, we can't address land use, we can't address infrastructure virtually outside of a planning context. And so I think, in terms of right now, planners everywhere are engaging communities. We're envisioning sort of future changes and transformations to communities and cities across the world. And so I think, one of the things that sort of I hope to sort of leave an impression on the field is that we have to sort of merge sort of the disciplines of planning, public health, and engineering, right? And I think that they have an evolutionary history, but much like sort of human history, we have to we tend to isolate and segregate. And so public health went in one direction, planning went in another, engineering, but we have classic examples from John Snow and the Broad Street Pump to sort of the work that W.B. Du Bois did in Philadelphia, sort of outlining those intersections between planning, public health, and engineering. And with sort of the reemergence of some of these environmental issues at that nexus, we have to find our way back to it, right? And so in terms of what can we do in the immediate sort of aftermath or reflection on a report like this is to sort of recenter public health and all that we do, especially in planning. I think historically in planning, we think about the physical outcomes and gains from implementing plans. We think about sort of ribbon cutting ceremonies with elected leadership bragging on this newly developed building or infrastructure. We also think about the economic gains and activity that are facilitated by these improvements. What we haven't historically thought about are the public health gains, right? Or the social gains. And we have to sort of use those as as talking points and indicators for improvement and transformation as well. I also would be remiss not to mention that to the students that we now have a dual degree in public health and planning that was just established, and I'm mentoring the first student coming through that program right now. And so there's an immediate opportunity for you all to be trained in both planning and public health to address these issues that a lot of my colleagues have talked about.
So as a fellow planner, I'm not a public health professional and I don't oversee a joint degree. I'm a planner. I have some next data steps. That's my thing. I don't know if the data sets that you created are part of an open data portal that you yourself created, or if it could become a part of an open data portal. But I invite you to maybe, if that is the case, take a look at our open data portal. We put out the vital signs report for the city of Baltimore every year. And you can start to see some of the variation that was spoken about, the Tale of Two Cities, underneath some of these maps that you already have. So for example, I'll just give you something very tactical. Technically, we have this walkability that kind of radiates from the center. But if you look at the level of vacant and abandoned buildings, you'll see that there's the east side that has vacancy and the west side that has vacancy. And you can bring that data set right underneath here and probably do some calculations on the walkability in vacancy areas and walkability in non-vacancy areas. And if it's a high vacancy, if it's walkable, like there's nobody walking there, right? So even though technically it's physically walkable, there's not the activity that you might actually see. And so one of the things that we now can show, because we have about 100 different indicators for all neighborhoods in the city, in the areas that we saw the greatest number of vacancy reduction, we saw the highest number of demolitions, which is part of Governor Hogan's Project Core. So we all think, oh, there's all this vacant and abandoned building. Let's demolish. But if you don't have a plan, and if you don't have a policy, and you don't have a goal, those demolitions don't do anything for the community. So our data actually shows that in the same neighborhoods where we saw these great reductions in vacancy, increases in demolition, we actually saw increases in violent crime, which sounds counterintuitive, right? That demolition should be reducing violent crime. But demolition without the opportunity to go behind it is actually an act of violence in and of itself and cause even more harm in some of these communities. So I invite you to kind of link data sets, and maybe you can like have a data geeky way that way. And to the point being that it could lead to action.
So do we have some questions for our guests here today? Yes, go ahead.
Oh, hi, my name is Eric Stone. I'm a PhD candidate in the Housing Department. And I live in Baltimore City. I live in north of the Square. I wanted to ask, firstly, are any of you familiar with the term Smaltimore? Y'all have heard this before? I just want to make sure. I just want to make sure it's a thing, right? For those of us who live in Baltimore. No, I wanted to ask.
So maybe share it with the
So
group.
Baltimore, the thing about Baltimore is that, I was going to address this in my question.
Oh, okay.
Baltimore is made up of a lot of really small communities, and it's really small relationships that really kind of, I would argue, get things done in Baltimore. Kind of these close networks. My question is that part of the reason Smaltimore is a thing is because of the historical legacy not only of racial segregation, but of spatial segregation and the creation of these very small little communities that have very diverse needs, whether you're talking about Southwest Baltimore, North Baltimore, East Baltimore, or kind of Cherry Hill on the very edge of Baltimore. So how do you overcome those challenges when you have such diverse needs, such diverse opinions, such diverse, I don't want to say values, but diverse understandings of where people live and how, frankly, the city has failed these people? How do you overcome that?
So obviously I think about this all the time. This is my job. If you think about the neighborhoods of the city of Baltimore, they're like the muscles. They're the muscles of the city, right? And what are all of the indicators that we see here? They're the arteries and the veins that can actually bring these neighborhoods together. And you will see that some of our neighborhoods don't have those connectivity resources. And because of that, they start to atrophy. Literally, they start to atrophy because they don't have the bloodlines. And I don't literally mean bloodlines, I mean people, ideas, innovation, digital access, transportation access. And in fact, that's one of the things that we found is causes this kind of disparity. We have neighborhoods that are disconnected socially, physically, digitally, financially. And when I say disconnected socially, for anybody that's taken the sociology class, right, you can have a lot of strength of strong ties, and that we see that in Baltimore. There's lots of neighborhoods with really strong ties, but it's actually the weak ties to other cities, like the other 25 cities. I hope that now we have these weak ties to learn from them, exactly as Sadia said. You know, what was the thing that actually, what can we do that could be stolen from another city that can catapult us to this next level? And now you can measure it. You know, how far do we need to get to everybody to have access to transportation? So it's those weak ties that we got to inject into some of our neighborhoods, and that's a challenge. Some of our neighborhoods think that they can't learn from some cities think that they can't learn from other cities. Some nations think that we can't learn from other nations. We have to kind of dispel that, and I think this is a great study to do that.
But I think this is also where this report comes in very handy, is that, you know, the granularity of the data that they're generating allows you to look at the within city variability on some of, you know, with respect to some of these attributes, right? So you know, whereas before, you know, like when you say like one city, you had like one value, a couple of values for that city, right? But this is like the spatial resolution is so fine such that it really enables you to look at, you know, the differences, neighborhood level differences, right? So, you know, I mean, when we look at city, we tend to think of it as a one entity, but you correctly pointed out within that one entity, there's, you know, microcosms of like many small mini city or neighborhoods and so forth. And a lot of the times our indicators that we use fails to capture that heterogeneity that exists at the neighborhood level. So I think what's I come away that's really exciting is you know, this indicators that they are generating, and that I understand is open source, so that will be available, like you said, to everybody, and then we can build on that. And so I think this is a you know, like step in the right direction, and that allows you to answer some of the questions that you are posing.
I think my recommendation is going to be completely non-traditional public health here. Throw parties, get people outside, get them together, right? Like, we don't need, like, we had a loneliness pandemic before the pandemic of COVID started. We had disconnected neighborhoods. That isolation doesn't just like, it has to be a human to human connection, right? And it's an individual to individual connection. The system level mechanisms are critical, right? The learning, the collaboration. But unless I personally have a human to human connection, the reason I'm here is because Jennifer and I connected and talking about nature months and months and months ago, and we've maintained that relationship over Zoom. But we need to have the kind of events that bring people together in the external world. And so I think it's somewhat more of a simple solution, but one that I think we do need to invest in.
I think that the concept of social determinants of health is what is going to bring a lot of professions together: planning and transportation and housing and food. So the platform, I think, for transformation in Baltimore, as it is in most countries and cities, is the social determinants of health, because it is multidisciplinary, it is multifactorial, and if we can bring that group together as a policy group, to focus on achieving equity through, because we want to move from these disparities to equity, and one of the mechanisms for achieving equity is the social determinants of health. And I think that around the table, where so many disciplines are involved, we can have a transformed city, possibly by 2030. But I think that's the next phase, to bring all of these groups together and focus on the social determinants.
Could I toss an answer to the Baltimore question? So I really like the answer about throwing parties. Sadia, I really like that. That should be like a medical prescription on a prescription pad that you can go in, because a lot of what ails us, not just in Baltimore City, but like as people living in the United States, is isolation, and it's making everyone crazy, and
and angry. And you guys all know, I'm sure, that during the pandemic, particularly during lockdown in 2020, when so many people were at home isolating, there were fewer cars on the road, right? And everyone predicted that we were going to clean the atmosphere and reduce greenhouse gas, and then all this like magical stuff was going to happen because we were all stuck at home. But what actually did happen was that traffic violence increased. Fewer cars, more traffic violence. Why? Because people are angry and crazy. And so I think parties are a great solution. I think it's a great policy prescription. I'll also mention that I think the thing about parties that's powerful is that people gather in the service of joy. And I think that has to be part of the goal. Like, it has to be a policy goal. Doesn't the UN measure the happiest countries and we're always at the bottom? Well, we have a policy goal to be happier. But I think the reason that these sort of social gatherings have the potential to be powerful and transformative and to help change Baltimore, it's in the service of some action that makes the community better. So just a quick example, bringing together the planning and the public health and the activism sort of energies that I have. I established a coalition just in the area around where I live, north and east of Patterson Park, that is particularly harmed by the residues of residential segregation, redlining. One of my fellow panelists mentioned the importance of access to parks. So there's a park, a 10-minute walk from the African-American community north of where I live. It's 10 minutes, they can walk to Patterson Park. What's the big deal? Why aren't they walking more and taking advantage of this great amenity? You know why? Because there are two highways, not one, but two functional, major arterials, Orleans Street running east-west and Sand Street running east-west, that function as highways that bisect this part of town and isolate African-American neighbors from one of the greatest parks in the United States. They have to cross two highways to get to Patterson Park. I know African-American legacy residents who don't know the sort of friendly, familiar names of park structures, like what we used to call the pagoda that we now call the observatory. They don't know what it's called. They don't know what it's, they've never seen it. Their kids have never played in the park. Why? Not because it's far, because it was cut off by racism, the residue of these roads. So anyway, so I started a coalition to bring together Black and white neighbors across this highway divide in the service of creating more walkable, accessible streets. We call it the Livable Streets Coalition. And we did some interesting things during lockdown in the early part of the pandemic. And we made a plan to install some traffic calming, pedestrian friendly infrastructure. We got sidelined because we don't have resources, and the graduate student who was working for me had the nerve to go get a job in California. But she's awesome. But I think that the idea was very energizing for people. And Black and white neighbors who never normally talk to each other, have nothing in common with each other. Realize that we have this shared enemy, and it's this highway, and let's work. So I believe that that's something that can work in Baltimore, and it can be scaled.
So, just 1 minute. Do we have any questions from the chat? I don't want to.
I was just checking that and typing in if there were any questions. So,
Okay.
But so far there's none.
Okay, all right. Please go ahead.
So thank you, Dr. Roberts. I really appreciate it. The work that you and your colleagues have been doing. I'm going to have to be the person to give the over personalized comment. So my family is from Baltimore. My grandfather came in the Great Migration North, like many other African Americans, to Baltimore in the late 1930s, as did my grandmother. And, they settled in the city, raised 6 children. Most of them had doctorates or a military career, and all these opportunities. But yet it was a highly under-resourced city, which is exactly what we're talking about, especially for Black folks, right? So I really appreciate the comments that are being made about resiliency and pulling from that resiliency. I don't know if it's Delegate Lewis, if you said that, but the history or my apologies, someone else, but the legacy piece. And that what I think needs to be centered in this conversation, it would be very welcomed as we talk about actually creating change from the wonderful data that's been collected and the different ways that folks are collecting it and talking about it, is centering the people that are there. I mean, it's a huge part of the puzzle because, you know, they know the experiences of what it means to be resilient and to survive the city, and to thrive in the city. And if you leave them out of the discussion, we'll have fantastic data and fantastic projects, but they're not really formed by the people. That's why I'm very excited about the work that has been mentioned thus far. But I think it's a key component here in affecting change. So this is highly personal for me as we have seen, you know, the city go in the direction that we don't want it to go in. There's so many variables. I'm trained as a sociologist, so I'm thinking about deindustrialization and neoliberalism and all the different factors, right? Okay, all right. But really centering the folks that live in the city and those that are native to the city and live in the city.
Can you say what neighborhood you grew up in?
Well, I'm from Columbia, Maryland, because I'm part of that great, so the exodus of the Black middle class from the city, right? Even though for a time my parents did have a home, and I did for several years live in what is now called Pigtown. Yeah, yeah.
Because,
But they were in West
I would
Baltimore.
love to, other technical questions, I would love to see the demographic breakout of all the 25 cities. I'm assuming Baltimore is probably one of your most segregated cities of all 25, so that kind of speaks to this issue. And Baltimore is a majority African-American city. There's a huge variation in the African-American experience within Baltimore City, and we have data that can be useful. So if we just looked at life expectancy, we have two neighborhoods, Howard Park on the west side, Clifton Berea on the east side. They're both 93% African-American. There's a 15-year life expectancy gap between them. What is going on spatially in these two neighborhoods? Howard Park is, you know, got high home ownership and got nice trees and it has occupancy. Culture in Montebello is 35% vacant and abandoned housing. That has lost so much population over the last 7 years. So we can even look at the variation even within the African American experience because it is a majority and tell a more nuanced story, right? That there is plenty of opportunity if you have a good, healthy, quality place in your neighborhood.
And I think it's an excellent point. It's also one of the take-home messages of the paper that, you know, to be effective in any of its efforts, everything has to start and finish with local knowledge. And it's a huge emphasis in the manuscript. And so with leaving us on that note, I'd like to turn it back over to Dr. Roberts, who has a few final words.
Thank you, Amy. So this has been an excellent discussion, and I could not be more thrilled how it just kind of, you guys brought this energy that it just made me so happy, and that's exactly how I kind of envisioned it. And this actually kind of has a personal note that I moved back to Baltimore 7 months ago. So I think a lot of the things kind of ring true in terms of things that I've seen in the paper, that we've heard, that I'm experiencing. But I wanted to actually make sure I have a thank you to everyone who helped put this together, because as Dean Luciak had mentioned, Jim Salas, who's pictured right there, he actually, I don't even know if he knows he's my mentor. I will tell people to be my mentor in my head. But anyhow, he pulled me into this project and he asked for me to be part of it. And that's a picture of us from about a couple months ago where he was so excited that the launch is going to happen. And so I wanted to thank him for pulling me in, as well as the whole global collaboration. The launch committee, we have Amy, Rianna, Megan from Hopkins, she left, and it's funny, it brings back this little Hopkins thing going on. The Sapkotas, okay, just call them twice, Sapkota, Megan, and me, we all went to school together at the same time, so, you know, kind of bring a little family reunion. Everyone in the dean's office who helped in terms of even just bringing in freshmen. We have Kelly and her whole communication team, Aaron, who's still around, of course, Dean Luciak, Deshanka, so everybody who helped, because a lot of times I was like, I don't know how to plan a launch. Like, what? I don't even throw parties. Maybe I need to ask you how to throw parties. But obviously, folks, the mayor's office, I put a request, you know, you put the little black box request, and you're like, well, whatever, see what happens. But Jessica and Jack got back to me, so I want to thank them. And obviously, Mayor Brandon Scott for his words. And then last night, my students who came and were helping with me, we have Janelle and Andy, and then Eric in the back, he was a photographer who did the photos of the sustainability report. I asked him one day, I said, could you go out to take some photos? And I think it was raining or something, but he did that. And so all of this, I just wanted to thank everybody for bringing this all together. And I want to put our hands together one more time for our panelists. Your time, your insights, and just, stepping out and coming over to College Park. Thank you again.
Do you want to